Hello, this is Dr. Songcho Park, Director of UB Plastic Surgery. Today, I will talk about minimizing scars while safely removing ruptured silicone implants and replacing them with new ones. The patient underwent breast augmentation with allergan implants 10 years ago and recently discovered a rupture, leading her to visit our clinic. A breast ultrasound confirmed a ruptured right implant. The presence of silicone between the capsule and outer shell is called a subcapsular line, while a torn outer shell is referred to as a defected envelope. Both findings were observed in this case. In a standard breast augmentation, a 3.5 mm incision is made, but revision surgery requires a slightly longer incision to remove the capsule. When an implant ruptures, an inframammary incision is preferred to minimize the risk of residual silicone. The subcutaneous layer is dissected to expose the capsule, which is then incised to remove the ruptured implant. The entire capsule is removed as a whole, including both the front and back. Breast asymmetry and volume differences are assessed, and if present, the implant size or projection is adjusted for balance. Before suturing, the incision measures 40 mm, but using a specialized suture technique, it shortens to 35 mm. Minimizing the scar length during closure is essential. Most importantly, the inframammary fold must be properly positioned to ensure the scar remains hidden after surgery. After surgery, the upper bulging on the left breast was successfully corrected, and the inframammary scar remains hidden even when raising the arms. Ultrasound confirmed that no residual silicone particles were left behind. The new implant is well positioned and a thin capsule has formed around the implant. Thank you for watching.